You're welcome back to Sunday Breakfast on Channel 1 TV. Now, we're diving straight into a health discussion, and we're talking about childhood cancers. As we all know, September is Childhood Cancer Awareness Month, and so we're shining a light, throwing a light on cancers that affect children. And joining us for this very important discussion is Dr. Balogun. He's a child health specialist at the Pediatric Oncology Unit at the Kolebu Teaching Hospital here in Accra. Doc, thank you so much for joining us.
Thank you so much for having me.
How are you doing?
Yeah, I'm so fine.
Work, everything?
Yeah, it's tiring, but we are coping.
Yeah.
Very stressful.
Yeah, but we are used to a life of stress.
Wow. Even before we go on to talk about what we have, maybe we should just say a big thank you to you and all the guys at the Pediatric Oncology Units, right? We see the dedication to the work you put in, especially for our young children, and I must say it's incredible.
Thank you.
I was at the launch of the Childhood Cancer Awareness Month, and I saw this presentation by children who are going through, and I'm like, it takes a different level of dedication and empathy, really, to be a child worker in the health space. And I think our professionals, our doctors, our nurses are doing amazing. So, Doc, on behalf of, thank you so much for the work you do.
Thank you.
Wow.
Thank you.
I have friends who are doctors, and before they even chose, the specialty that they might, one of my friends was like, she doesn't think she can do pediatrics because if they're a baby, they have to be a certain temperature. You have to know the differences when they are 1, 2. Like every stage in their life is different. So pediatrics are doing amazing. But Dr. Balogun, talk to us about cancer. What at all is cancer? When we say cancer, what is cancer?
Well, cancer, generally speaking, is something that has to do with an abnormal growth. Yeah. Everybody undergo the process of growth. In fact, our body also repairs through multiplication of cells. However, along the line, when things goes abnormal, loses control, just like an aeroplane flying has to be connected to the tower for control. Just the same way our body is regulated. So like if you have a cut on your hand, and after some time, the blood will stop. Then after a while, you see new skin begin to form. And once it gets to the particular level of the other normal skin, it stops forming. So that is because it is under control. But along the line, things can just happen, what I call accident of nature, and then start growing abnormally. It start growing beyond boundary. So when it start growing beyond boundary, we call it tumor. It becomes a swelling. Now, some tumors can be benign. That means that they remain there, they cannot spread to other parts of the body, but there are some that could become what we call malignant or cancerous, meaning that they have potential to spread. So a cancer can be a tumor, but not all tumors are cancers. So that is what happens. And this can affect any part of the body, from the head to the toe, any part of the body, including the blood, bone marrow, anywhere. Cancer can take place anywhere in the body. So when there's an abnormal growth, and that growth becomes uncontrolled, we call it cancer.
So in children, what exactly am I looking for? How am I going to tell that, my child, maybe they're, hyper 1 minute and then they're quiet? What are the symptoms that will show me that this might be a cancer? Or do I have to bring my child to the hospital for them to diagnose that it is a cancer? Yeah,
very good question. It's been said that the first nurse that a child has is the mother, or let me say the parent, because you see these children every day, and most of the time you are able to identify when you see something strange, something that is unusual. For instance, there are some signs that when you see in a child, you can say, oh, you may not know what it is, but it will not be your duty to call the attention of those who may likely know what it is. So, but when you see something that is strange and you don't bother about it, or you try to rationalize it, talk it off, oh, that is how it used to be, and all of that, that is when the problem comes in. Now, what are some of those signs? Especially, you see a child, a newborn baby or a child in the neighborhood, you look at the eye and you see that rather than the eye, the center of the eye to be black, just like our own are black, you see something whitish inside the eye. So that is abnormal, and that should make a mother to call and say, oh, this thing it's not the same way it is with other children.
Yeah.
So you may not know what it is, but by the time you come to the health care workers, they'll be able to tell you, oh, this could be a sign of retinoblastoma, which is one of the cancer we see in children. Or you see a child, you look at the arm, it's covered, the palm, it's covered that it's whitish than it's supposed to be. You check the eye, it is white. And it's covered that this child, from every now and then you go to the hospital and they tell you that the child needs blood and all of that over and over. Or the child is having fever. The body is always hot over and over. So all of this, they may not be cancer, but they will likely tell you that, oh, something is abnormal. Go to the hospital. And when you get to the hospital, the health worker will be able to tell whether it is. If they not tell you, oh, it is not cancer, that can give you some rest of mind. Then if it is cancer, it is always better when they come in early. And it is because up to 80% of childhood cancer are actually curable, unlike what is obtainable in adult. And if they present early, that is the essence of our awareness. We want it that when you notice something abnormal, call the attention of those who know about it, so that if it is cancer, we can quickly begin to address it. Because at that point, it becomes curable. Then if you notice a swelling in any part of the body, or your child is complaining of pain, bone pain, always crying for pain, these are signs that it could be cancer. We are not saying it is cancer, but it could be. And if it is cancer, you'll be doing well when you eventually allow that child to present early to the hospital. It gives us a better chance to treat that child and achieve a cure. Or the child is always complaining of headache, vomiting in the morning, and all of that, always getting weak. Other children are active, but this child is always weak. So when you see these signs are there and they are persisting, it's a sign that you may have to get to the hospital because it could be cancer.
Wow.
Yeah.
It's interesting. But what then will you say are the causes, or let me say, are there causes of cancers in children? What are the causes of cancers in children?
Yeah. Well, unlike adults, where you say, when you smoke cigarettes, you may have lung cancer. You do this, you may have this. Unfortunately, in children, there are no identifiable cause of this cancer. Like I said earlier, it's just one of those accidents of nature. It's not because maybe the father has done something or the mother has done something. That's why the child is coming down with cancer. Any child can have cancer, regardless of who the parents are, the socioeconomic status, the location, because cancer is a disease that crosses border. It does not respect age, gender, your background, socioeconomic status. It affects the children of the poor, the children of the rich, whoever. Anybody can have cancer. And I think that this should make every one of us to really wake up to this, because if my own child does not have cancer, it does not mean that other people's children cannot have it. So we must all wake up and see how we can rescue our children who eventually come down with cancer.
Dr. Balogun, what kind of cancers do children get? I'm sure they have, and which ones are the most serious or the most grave ones?
Well, okay, let me start with the type of cancer that children can have before I come to the seriousness of the cancer, because every cancer is serious. Well, from the head, there are some tumors that can grow in the brain, and then children can come down with a brain cancer. So it can happen in the eye. I mean, it can happen in any part of the body. Yeah, we have seen children, some of these pictures, you can see some of them. We have seen children with cancer in the eye. You see their eyes protruding, coming out from the globe. We have seen some of these children come down with swelling in their neck, in their jaw. So some in there, and in fact, there's an infant recently that came with swelling in the left arm.
Wow.
And it's cancer. So once we notice any form of swelling in any part of the body, it could just be cancer. We should not say, oh, it will go. Or we start rubbing it with all of this ointment, hair, and the rest. Start rubbing, and unfortunately, the more you rub some of those things, you see them becoming bigger and bigger. So the goal is, and then it could also be cancer in the blood.
That's leukemia.
Yes, leukemia. So which is currently the commonest cancer that we have seen, especially in Ghana and also in a major part of the world. So it could occur in any part of the body, in the leg, name it.
Wow.
So anywhere, any part of the body.
You say there are no identifiable or known causes of cancers in children, but then to push a little further, we say there are probably risk factors that are sort of give a clue as to what could be the reason why this child is suffering from whatever cancer that it is.
Okay, thank you. Yes, there are risk factors, but just like we know, risk factor does not also mean causative.
Yeah, they are not
They might not be like, okay, if you have this. Like, for instance, one of the risk factors is exposure to radiation. But research has also shown that there are even children that are exposed to radiation, eventually in life, they didn't come down with cancer.
Wow.
Whereas some other children who have never got exposure to radiation in their life, eventually will come down with cancer. So those risk factors are there. And sometimes genetics. There are some cancer also that possibly inherited, and sometimes that is why we ask questions about, okay, is there family history of cancer and all of that. We have also seen some children also, if you look at their lineage, there is no any history of cancer, and then they still come down with cancer. So there are risk factors, but those risk factors are not so causally related to the development of childhood cancer.
So, Doc, I'm at the hospital. We've diagnosed that. What's the next step?
All right. At the hospital, usually when a child is diagnosed with cancer, we have protocols. And currently in Ghana, we have protocols that we follow, and treatment is available. That is a good thing about Ghana. As you may know, I'm a Nigerian, but I'm here in Ghana because Ghana has a very well-structured cancer treatment for children. So that is why I have come to gain exposure, to see what is happening in Ghana, and then see when I go back to my country, I can also replicate what I see. So Ghana is doing very well when it comes to childhood cancer, and treatment is available. The major problem is this, that we are creating awareness about. Number one, help us to detect these cancers, these early signs of cancer early. Then when it has been decided, and the child eventually come to any hospital, we call on all healthcare workers, nurses, doctors, general practitioners, don't just rationalize swellings. Any abnormality you see in children, escalate. Let those children come to centers where these cancers can be diagnosed. Sometimes it is not an error if you don't know what to do. But when you don't know what to do and you don't know how to channel a patient to where they can find help, that is where the problem comes in. So we want educate like there are some children that will come to our hospital, and then they will say they've been going from hospital to hospital for about the last 2 years. They have been treated for malaria, for typhoid, for this, for that. When they have come with swelling, when they have come with body weakness that is persistent. So, and then the next thing also is that sometimes when these children now come to the hospital, when they come to us, we see them looking at us in the face. Doctor, we need help. We want to offer help. But there's no money.
Yeah.
There is no money to proceed with the treatment.
Wow.
So, and sometimes this is a big frustration to us. I remember one of my bosses was saying, she doesn't even know how to proceed and do all of this awareness. When we will go and create awareness, and these children will come to come and meet us for help.
And now they can't.
And now they have come.
Wow.
We cannot help because there is no money.
Dr. Balogun, we'll go on with the challenges you're facing, but
Okay.
let's just share our WhatsApp line with our viewers so they can send in their questions as well. So if you are wondering how you can be a part of this conversation that's ongoing, the WhatsApp line is 0204-447-033, 0204-447-033. Share all of your questions, your comments, anything that's just on top of your mind that you're not too sure about childhood cancers that we are discussing. And we'll be Dr. Balogun, John Balogun, who's our guest on the show today, will be glad to help demystify the misconceptions and put straightforward the facts. Doc, so you're talking about the challenges.
Yeah.
Of course, funding being a major problem, right, from the parents. I would want to ask you about what the state is also doing, because you know we have a national health insurance scheme which is mandated to assist in funding for some of these diseases. We know that for now, it takes care of only about 4 or 3 of these childhood cancers. What's the situation like with regards to the NHIS and its funding for cancer cases, particularly for children?
Well, thank you so much for this question. I would want to really appreciate the state for the effort. I mean, it's a huge success. The fact that some of this cancer treatment has been made available, I mean, there's a policy that, okay, let us cover this under health insurance. I will only plead that we should make it more robust and make it readily available for these children. I'm sure it will go a long way
to help,
to really help, to helping these children to fight and win the battle
fight
against
cancer.
Childhood cancer.
But the question then is, why is it the case that we've all come with a swelling, right? Let's say 2 patients or 2 parents working with their child who are cancer patients, all showing swelling, but the NHI is able to cover for one and not the other. How are you able to tell the other parents that even though your symptoms are the same, the NHIS is only able to cover for parent A, whose child is having almost the similar symptoms to parent B, although the cancers might be different? Why is that the case? Is that not another issue of maybe discrimination?
Form of inequality.
Or inequality. Why is the NHIS covering some particular cancers and leaving out some particular cancers?
Well, I'm not sure I have an answer to that, but I will only come with a plea because I believe that those who are involved in this are also watching us and listening to us. I want to plead that these children need help. And you know, when we are able to salvage a child, we have added an average of 60 years to the productive life of the nation.
Of the nation, the human resource base.
Yeah, the resource base. So we should not just allow any child to die a preventable death. And I think that if there is anything that the government can do, one of those things is for them to preserve the life of the citizen, which I'm sure the government is trying. We're only pleading for more. Yeah.
So just briefly talk to us about the cancers that the NHR, I know I'm pushing, I should be directing some of these questions to policy implementers, right? Yeah, but you are in the space and you have a little more insight into this, and that's why I keep coming back to the NHS. Just talk to us briefly about the cancers the NHS at its current state covers.
Well, in answer to that, I will also be very careful because as it is now, I guess that policy about covering under the NHIS, likely it is still in process. So maybe we are still waiting for the implementation phase. But I must tell you that currently it is that we have not gotten to the implementation phase because our patients still pay out of pocket.
Wow. So even though on paper it is supposed to cover, the funding doesn't come as regularly or doesn't even come at all.
Well, I'm not so sure now, but based on my own personal experience, I am not sure it has started coming.
Wow.
I don't think that started coming. But I'm sure the government is not sleeping over it. Because for them to have the will to put it on paper means that they have the will to...
Yeah, but it's one thing having the will, and it's another thing. So, see, we'll probably make the call later on the show, urging government to pay serious attention to this. And my colleague Eno has some questions she wants to ask you before you go.
Okay. Yes. Dr. Balogun, tell me what treatment options are available when these children present themselves with a cancer? When you finally diagnose them, what treatment options are available? Okay,
well, majorly the treatment option for them is chemotherapy. There are some of them also that will need surgery, and then there are a few others who will need radiotherapy. So as much as possible, our children, because they are children, we want to protect them against so much exposure to radiotherapy, unless it is absolutely necessary. Most treatment options are chemotherapy and then plus or minus surgery. Yeah. So those are the options that are available.
Is surgery like the last option?
Not really. It's more, we call it combination therapy.
Okay.
Yeah, there are some that when they come with very huge tumor swelling, we want to use drug to shrink it, to allow the surgeon to be able to bring out the tumor totally. And then afterwards, we'll continue with the chemotherapy. So it's not like individual, each of these treatments is independent like her. So it's like working together to achieve a cure at the end. So that is it.
Right. Doc, how can we join hands with, the Pediatric Society to fight these, or to help, shine a torch on childhood cancers?
Thank you. Like this you are doing now is one of it. We want you to do more of it. We want, number one, we want these children to come in early enough. when they come in early enough, like currently the cure rate of childhood cancer in Ghana is between 25 to 50%.
Okay.
However, in developed countries, they have up to 80%.
So we should be doing more.
Yeah, so and the major reason they are achieving those success, number one is because those children, they dictate them early. And then number two, there's availability of modern diagnostic equipment, facilities, and then treatment and supportive care for them. So these are areas that we will really want you to help us so that when many Ghanaians can come to this, at least come to the hospital and visit our unit one of these days. See these beautiful souls, these young children battling cancer, and by the time you come and see them and you look into their future, you see the bigger picture that a lot can come out of these children. Like recently I came to the clinic and I was sitting there, I was meeting that lady for the first time, very beautiful young lady, looking so robust. I thought that she was the mother of one of our patients. I said, no, doctor, I've come for my yearly review. She had cancer as a child.
Wow.
You know, another one came, she's already a nurse, 26 years old, had cancer as a child. So now they have been cured of their cancer, and now they are being productive to the nation.
That's true.
So we should come together and see if your own children does not have cancer, but God has blessed you with money. Come and support these children. It may not be like you are coming to give them money. You can come and say, okay, what do you need? What do you lack in the facility that we can be of help to? And purchase those equipment for us to help us with diagnosis, to help us with treatment. You can even go to the pharmacy and deposit money in the pharmacy and say, okay, this money is for children who have cancer.
So that coming from education.
So, sometimes when we say the government must do everything, the government cannot do everything. We are the government. We have to come together, support the government to make sure that we're able to achieve better outcome for our children who are battling cancer.
Dr. Balogun, there's some questions here for you. The first one says, my child normally complains of headaches. What could be the cause? And before you answer that one, are some childhood cancers genetic? If there are genetic cancers, how curable are they?
All right, thank you. Well, for the question about the child who is having a headache, you know, a lot of things can cause headache. Right. But like I said, if the headache is persistent, like you've taken anti-malaria, you've taken all manner of analgesics, pain relief, and there is no improvement, persistent, please visit the hospital. All right, so because they might just ask you to do an imaging of the brain, at least to be sure that there's nothing to worry about. So that is my advice to that person. Please visit the hospital. And then regarding childhood cancer with genetic cause, yes, there are treatments for cancers that also have genetic cause. It's possible that some of those cancer may require some more intensive treatment, but there are treatment available for them, treatment options available for them. Maybe not necessarily fully in Ghana, but the most important thing is that let's establish that this is cancer. And then when we establish that it is cancer, we will usually guide you through the process of getting cure for your child. Well, so that is it.
Interesting. Doc, it's been so nice, for want of a better word, having you in the studio give us this proper education, break down what childhood cancers are. But just briefly, when we were talking, you talked about the challenges and how a lot of these parents, of course, you mentioned funding, and how a lot of these parents who their children have to deal with childhood cancers come to the hospital late, sometimes due to the lack of knowledge really in the space, and I'm choosing my words carefully, but also the stigma involved in treating cancer. How should we approach the area of stigmatization, right? When people even, the misconceptions on the streets are incredibly wild. People even think that it could be easily transferable, right? So when you have cancer, they sort to, just in a very brief way, talk to us about the stigma associated and why we should not discriminate against people who have to endure or go through cancer treatment.
All right, thank you so much. It's quite unfortunate, you know. Ignorance is a big problem. But one thing I want to say is that as much as possible, let us be nice to those who are having problem. Because, for instance, childhood cancer is not because the children are suffering from the sin of anybody. It's something
or
that
a curse,
or something, or a curse from the gods. There is no any god that is causing anybody. Childhood cancer can affect any child, any child. So because of that, since we know that this is one of the vulnerability of human, we should have mercy on one another. We should not discriminate. And let me say this very clearly, that cancer is not contagious, cannot spread. It's either you have it or you don't have it. If you are sleeping together in the same house with somebody who have cancer, it does not mean that you are going to have cancer. So it does not spread. So let this be very clear in the mind of every Ghanaian.
So empathy, kindness, show of concern, and love for each other.
Exactly.
And not discrimination and trying to, wow. Like I said earlier on, thank you so much for the work you are doing in the space.
Thank you.
It's one thing being a healthcare worker, right? And it's another thing being a child healthcare worker, because you're not only managing the condition of the child, you're also managing
the as well.
And it can be a difficult position to be in, quite
Dr.
a toll on
Balogun,
yourself.
thank you so much for joining us. We're grateful. You've really educated us. So like you said, if you have any, if you present yourself with any of the symptoms that Doc mentioned, the persistent headache, the swelling, the bruising, you know where to go, straight to the hospital.
And those who have to also bring the money for the treatment.
Yeah,
those who have
if
made
you can
promises.
afford,
not
please.
only the public, the you know what I'm talking about, the state.
The state.